understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by the faculty at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Okay, my name is Kevin Hartley, and this is my head-to-toe assessment for Indiana Wesleyan University. Nicole here is going to be my patient. Before she came in, we got her vital signs, which were normal. Her height and weight, which was good. Her BMI was only 20%. Her gait as she walked in was steady. Her balance and coordination were appropriate. After talking to her, she's alert and oriented. We did a Snellen eye test outside, and her general appearance is well nourished, well developed. We're going to start off by looking at her head in the general shape. We're going to feel for any deformities, noting the hair color and pattern. And we're touching the skin here, looking at the color, turgor. It's warm and dry. It's appropriate for her ethnicity. And we'll move on to her face here, and we're going to take a look at the symmetry of her face, including her ears. Everything appears to be symmetrical there. There's no obvious deformities or abnormalities. If we look at the face, we're going to palpate the temporal arteries, and then I'm going to come to the back here and feel her TMJ. If you could open and close your mouth a few times. There's no swelling or deformities there. Is that painful?
No.
And there's no crepitus either. While I'm here, I'm going to go ahead and take a peek at your sinuses, and I'm going to push on those. Is that tender?
No.
How's that?
Fine.
Okay. I'm going to take a peek at your eyes. Looking at the eyes, we've got green eyes. The sclera is white. It appears moist, and they look round and even to me. I'm going to take a minute here. I'll have you keep your head straight at me and follow my finger with your eyes only. So we're checking the ocular muscles. Those all seem to be working fine. I'm going to take a peek at your pupils. I'm going to shine a light in your eye here, and this is where we're going to check that the pupils are reactive and accommodating. And then we're going to check her peripheral vision here, and I'm going to ask you to tell me what finger I'm moving.
Left. Left. Right. Both.
Okay, that all seems to be normal. And we're going to take a peek at your ears. We're going to use an otoscope for that. We already kind of looked at them. Look at the outside. Everything appears to be normal. There's nothing hanging off. There's piercings here, which is pretty common. We're going to take a peek inside the ear, and we see a nice pink, shiny tympanic membrane. There's no drainage. Are your ears hurting at all?
No.
And this one looks good as well. And since we're here, looking at the ears, I'm going to do a Weber test. I'm going to hit this tuning fork and place it on the top of your head. Tell me when you hear it stop vibrating.
Stop.
Okay. And then I'm going to do the same thing on your jaw right here behind your ears to test the sound conduction through the bones.
Stop. Stop.
Okay. I'm going to go behind you here and do what we call a whisper test. I'm just going to say a word and you tell me what it is.
Lemon. Orange.
Okay, very good. We'll go ahead and take a peek at your nose since we're still at the head here. Everything looks symmetrical from the outside. Do you have any problems smelling or?
No.
Okay, any drainage noted?
No.
Okay, we'll take a peek up in here and we see the septum and the mucous membranes, which are pink and moist. The septum is intact and appears to be midline. No drainage noted there. If you would, occlude one of your nostrils and breathe in and out. Get a good breath. Do the same on the other side. Okay, now I'll have you close your eyes. I'm going to put something up to your nose and have you tell me what you're smelling. Occlude one of your nostrils.
Rose.
Okay, and occlude the other.
Lemon.
Wonderful. We'll go ahead and take a peek at your mouth again. We see the mouth is symmetrical. Go ahead and open your mouth for me. Say ah really wide.
Ah.
So we're visualizing the uvula, the tonsils, looking at the mucous membranes, which are pink and moist. No deformities. I'm seeing the hard and soft palate, and looking at the teeth, I do see one filling. The tongue looks beefy and red, which is normal, nice and moist as well. Since we're up here, we're also going to take a look at some of your cranial nerves, make sure everything's working right. I want you to look at me like you're really surprised. Now scrunch down like you're really mad. Okay, stick your tongue out at me. Be able to move that side to side. Okay, and then smile really big. Beautiful. Okay, we're going to move on down to your neck, and we're going to feel and inspect. Again, just like we did the head, looking for any deformities or abnormalities. Everything appears to be symmetrical. There's no jugular vein distension noted, and the trachea is midline. We're going to go ahead and feel her lymph nodes up here. And those appear fine. And we're going to feel the ones down here. Those are great. Okay. I'm going to continue with some neuro stuff here. Have you shrug your shoulders for me? Okay, you able to hold your arms straight out and keep me from pushing you down and keep me from pushing up. Okay, squeeze my hands. Beautiful. Okay, strength is even in both arms. The skin again is warm and dry and appropriate for her ethnicity. Cap refill is rapid. We're going to check your brachial pulses and your radial. Okay. I'm going to come down to your legs here and have you hold your legs up. Keep me from pushing down and keep me from pushing up. All right. The legs appear to be normal. There's no deformities here. Strength is equal in both. Cap refill is rapid. Looks like we've got a small injury here. We're going to check your femoral pulses up here in your groin. And we're checking rate and strength on that. And then we're also going to check popliteal. Pedal. Beautiful. All those are equal, 2+ and regular. I'm going to go to your chest, and we're going to take a peek at your general shape and size here. We're looking for any, again, abnormalities or anything that is asymmetrical. And have you take a big deep breath in and out. Okay. Everything appears to be moving equal bilaterally. I'm going to go ahead and give a listen. Just breathe normal. Sounds good. We're going to go ahead and listen to the heart while we're here. We're going to go to the second intercostal space. Listen to the tricuspid area. Herb's point. And the mitral valve. Okay, so we hear S1, S2, no adventitious heart sounds. Since we're looking at the chest, I'm going to go ahead and have you turn for me. And on the back, again, looking at the body, we're looking at symmetry, any crepitus, deformities, everything appears good there. Take a big breath for me. Okay, and the lungs are moving equal bilaterally. We'll go ahead and give a listen back here. Big breath. Beautiful. I'm going to go ahead and have you lay down for me. And here we're going to take a look at the abdomen. We're going to inspect. I see some scarring from previous surgeries. It doesn't look distended. Are you having any belly pain?
No.
No? Okay. We'll go ahead and auscultate. Okay, and then we're going to palpate. Does that hurt?
No.
No. Okay. Have you sit up for me. Just one more thing here. We're going to come back to your arms and legs and check your reflexes. So I'm going to have you just relax this arm for me. Okay. And the other. Just relax. Relax. Okay. Now ideally we would have her feet hanging freely, but the ottoman here is a little short. Okay. Okay. All right. Do you have any questions for me?
No.
Nope. That's all I have. Thank you.